High blood pressure, it's called the silent killer for a reason. Did you know that over 1.28 billion people around the world are living with hypertension? And nearly half of them don't even know it. That's right, your body could be waving red flags. And you might be missing them. The scary truth is that high blood pressure often develops without any obvious symptoms, but your body is always talking to you through signs like headaches, dizziness, fatigue, and even vision changes. Ignoring these early warnings can lead to devastating outcomes like stroke, heart failure, or kidney damage. But here's the good news: if you recognize these signs early, you can take action, protect your health, and possibly save your life. In today's video, we're going to break down the most common symptoms of high blood pressure, including one that doctors say is the most overlooked. Make sure to watch until the end. It could be the most important few minutes of your day. Before we dive in, don't forget to like this video, share it with someone you care about, and subscribe to our channel. Hit the notification bell so you won't miss our next life-saving health tip. Let's get started. Headaches, a common but overlooked warning sign of high blood pressure. A pounding or persistent headache might be more than just stress or fatigue. It could be your body's alarm bell for high blood pressure. While not everyone with hypertension experiences headaches, sudden and severe headaches are often reported during hypertensive spikes or crises. When blood pressure rises rapidly, it can increase intracranial pressure, leading to swelling and pain inside the skull. This can result in throbbing headaches, often accompanied by confusion, nausea, or vision changes. Research from the Journal of Headache and Pain 2024 suggests a link between high diastolic pressure and increased migraine occurrence, highlighting the importance of blood pressure management in reducing these painful episodes. Although headaches alone aren't a definitive indicator of high blood pressure, their frequency and intensity, especially if they deviate from your normal patterns, should not be ignored. If you find yourself frequently battling unexplained headaches, it's wise to monitor your blood pressure regularly and consult a healthcare provider. Early detection of hypertension can help prevent serious complications such as stroke or heart disease. Your head pain may be trying to tell you something important, and don't brush it off. Just like severe headaches, dizziness and lightheadedness can also be subtle but significant red flags of high blood pressure. After all, when your blood pressure rises to abnormal levels, it doesn't just affect your head, it also disrupts blood flow to your brain, leading to sensations of imbalance or even near fainting episodes. This is especially true in cases of orthostatic hypertension, where blood pressure spikes upon standing, causing reduced blood supply to the brain and triggering lightheadedness. While dizziness can stem from many causes, high blood pressure often compromises the flexibility and health of your blood vessels, reducing their ability to regulate circulation properly. This puts extra strain on your heart and brain, leading to moments of unsteadiness that should not be brushed off as fatigue or dehydration. In fact, a 2020 study in the Journal of the American Heart Association emphasized the link between sudden posture-related blood pressure spikes and dizziness in aging adults. Together with recurring headaches, frequent dizzy spells could be your body's plea for attention. If you've been feeling off balance more often, don't ignore it. Monitoring your blood pressure and seeking early medical advice could help you avoid far more serious complications down the line, including stroke or heart failure. Following recurring headaches and dizzy spells, another critical warning sign of high blood pressure that often goes unnoticed is blurred or double vision. Just like your brain, your eyes are highly sensitive to changes in blood flow. When blood pressure remains elevated for long periods, it can damage the small, delicate vessels in the retina, the part of the eye responsible for processing light and visual detail. This condition is known as hypertensive retinopathy. As blood vessels narrow and harden, the retina receives less oxygen and nutrients, leading to visual disturbances such as blurred or double vision. In more severe cases, high blood pressure can even cause swelling of the optic nerve, disrupting the communication between your eyes and brain. These issues may not be painful but are serious indicators that your blood pressure could be silently causing damage. What's important to understand is that symptoms like dizziness and vision problems are often interconnected, all pointing toward compromised circulation and pressure within your body. A 2023 study in the Journal of Human Hypertension confirmed that long-term hypertension significantly increases the risk of vision impairment. If you're suddenly struggling to see clearly, it's not just your eyes, it could be your blood pressure talking. Don't wait, get it checked. After headaches, dizziness, and changes in vision, another alarming symptom of high blood pressure is shortness of breath. Many people assume difficulty breathing is solely related to lung problems. But your cardiovascular system plays a major role, and hypertension can quietly interfere with both. When blood pressure remains consistently high, it forces the heart to work harder to circulate blood throughout the body. Over time, this extra strain can cause the left ventricle of the heart to thicken, a condition known as left ventricular hypertrophy. As the heart becomes less efficient, fluid may begin to accumulate in the lungs, leading to pulmonary edema, which manifests as breathlessness, especially during physical activity or when lying down. This means that even something as routine as climbing stairs may suddenly feel exhausting. According to a 2023 study in the Journal of the American Heart Association, pulmonary edema is one of the most common complications during hypertensive crises. What's striking is how these symptoms, from headaches and dizziness to visual disturbances and shortness of breath, form a pattern of your body warning you that something deeper is wrong. Don't ignore it. If you experience any of these signs, monitor your blood pressure and seek medical attention early. As we continue connecting the dots between various symptoms of high blood pressure, another critical sign that should never be overlooked is chest pain or discomfort. After experiencing persistent headaches, dizziness, visual changes, and shortness of breath, chest pain could indicate that your cardiovascular system is under severe stress. High blood pressure forces your heart to work overtime, particularly affecting the left ventricle, the chamber responsible for pumping oxygenated blood throughout the body. Over time, this pressure can lead to left ventricular hypertrophy, where the heart muscle thickens and becomes less efficient. This inefficiency creates an oxygen imbalance in the heart muscle, which may result in angina, type of chest pain often described as tightness, pressure, or squeezing. Moreover, hypertension damages the inner lining of arteries, encouraging plaque buildup and atherosclerosis, further restricting blood flow to the heart. This not only increases the risk of chest pain but also sets the stage for more serious events like a heart attack. While not everyone with high blood pressure will experience chest discomfort, ignoring it could be life-threatening when paired with earlier symptoms like breathlessness or dizziness. Chest pain is your body's red flag urging you to seek immediate medical attention. After warning signs like persistent headaches, dizziness, vision disturbances, shortness of breath, and chest pain, one symptom many people often overlook but should take seriously is frequent or severe nosebleeds. While nosebleeds may seem harmless or unrelated, they can be a subtle indicator of uncontrolled high blood pressure. When blood pressure is elevated for extended periods, it puts immense strain on the delicate blood vessels inside the nasal cavity. These capillaries become more fragile and prone to rupture, especially during sudden spikes in blood pressure. Although not everyone with hypertension experiences nosebleeds, research has shown a higher incidence of hospital-treated nosebleeds in individuals with elevated blood pressure. It's important to note that nosebleeds themselves don't cause high blood pressure, but in those with pre-existing hypertension, they can become more frequent and harder to stop. Moreover, if nosebleeds occur alongside other symptoms like chest discomfort, lightheadedness, or vision problems, it may signal a hypertensive crisis, which demands immediate medical evaluation. Ignoring these warning signs, even something as seemingly benign as a nosebleed, could delay critical intervention. By paying attention to these subtle cues, you can take steps toward early diagnosis and management, potentially preventing serious cardiovascular events down the line. Following symptoms like headaches, dizziness, blurred vision, shortness of breath, chest pain, and even frequent nosebleeds, another subtle yet serious red flag of high blood pressure is unexplained fatigue or confusion. Many people brush off these symptoms as signs of stress, aging, or simply a poor night's sleep. However, persistent tiredness and sudden episodes of mental fog could indicate that your heart and brain are under strain due to elevated blood pressure. When the heart is forced to work harder to pump blood, it uses more energy and oxygen. This can lead to a sense of physical exhaustion, even without physical exertion, simultaneously. Hypertension can damage the tiny blood vessels in the brain, reducing oxygen and nutrient delivery, leading to confusion, forgetfulness, and impaired focus. In extreme cases, this can progress to hypertensive encephalopathy, a dangerous condition marked by swelling in the brain that causes confusion, seizures, and even unconsciousness. These symptoms, while easy to overlook, may be your body's way of warning you about a deeper issue. If you or a loved one notice recurring fatigue or mental confusion, especially when paired with other hypertension signs, it's critical to seek medical attention and monitor blood pressure consistently. Building upon the earlier signs such as persistent headaches, dizziness, blurred vision, shortness of breath, chest discomfort, nosebleeds, and ongoing fatigue or confusion, another often overlooked but critical symptom of high blood pressure is nausea or vomiting. While these sensations are commonly attributed to food poisoning or gastrointestinal issues, they can also be triggered by dangerously elevated blood pressure levels. When blood pressure spikes to extreme levels, it may lead to hypertensive encephalopathy, a serious condition in which increased pressure causes swelling in the brain. This swelling can irritate the area postrema region in the brainstem responsible for detecting toxins and initiating vomiting, resulting in sudden nausea and vomiting. These symptoms often accompany others like confusion, vision changes, or severe headaches, signaling a possible hypertensive crisis that demands immediate medical attention. A study published in the Journal of Clinical Medicine 2023 confirmed that nausea and vomiting are frequently reported during hypertensive emergencies, emphasizing their role as warning signs of severe cardiovascular distress. When combined with the previously mentioned symptoms, they create a clearer picture that the body is under serious strain. If you experience nausea without a clear cause, especially alongside other high blood pressure symptoms, don't delay. Seek professional evaluation right away. Early recognition can be life-saving. As we continue exploring the cascade of symptoms linked to high blood pressure, ranging from headaches, dizziness, blurred vision, shortness of breath, chest discomfort, nosebleeds, fatigue, and even nausea, another telltale sign to watch for is heart palpitations. This symptom often feels like your heart is racing, fluttering, or skipping beats, and while it can be triggered by anxiety or caffeine, persistent palpitations may signal a deeper issue tied to hypertension. When blood pressure remains elevated over time, it places excessive strain on the heart. This added pressure can cause structural changes, particularly left ventricular hypertrophy, a thickening of the heart's muscular wall. As the heart works harder to pump against this pressure, the electrical pathways that regulate your heartbeat can become disrupted, leading to irregular rhythms and noticeable palpitations. A 2020 study in the Journal of the American Heart Association found that aggressive blood pressure control significantly reduced the risk of atrial fibrillation, a common cause of palpitations. This suggests a direct connection between hypertension management and heart rhythm stability. So, if you're experiencing palpitations, especially alongside the earlier symptoms mentioned, it's time to take them seriously. Consult a healthcare professional promptly, as these sensations could be your heart's way of signaling that it's under stress. Early action can protect your heart and brain. Building on the growing list of warning signs: headaches, dizziness, blurry vision, shortness of breath, chest discomfort, nosebleeds, fatigue, nausea, and heart palpitations. Another subtle but important symptom that could be linked to high blood pressure is tinnitus, or a persistent ringing or buzzing in the ears. While tinnitus is commonly associated with hearing issues or loud noise exposure, elevated blood pressure can also play a surprising role. When blood pressure is too high, it can strain the delicate blood vessels in your inner ear. This strain may disrupt normal blood flow, leading to vascular turbulence that your brain interprets as sound even when there is none. It's essentially your ears picking up on the stress your blood vessels are under. A 2020 study in Frontiers in Neurology found that individuals with hypertension were significantly more likely to experience tinnitus than those with normal blood pressure. Moreover, some medications used to treat high blood pressure, such as diuretics, can occasionally worsen or trigger this condition. If you're noticing unusual sounds in your ears, especially in conjunction with any of the previous symptoms, it may be time to take your blood pressure seriously. Talk to a healthcare professional to determine whether your ears are ringing and warning you about something bigger. Following the trail of symptoms like headaches, dizziness, blurred vision, shortness of breath, chest pain, nosebleeds, fatigue, nausea, palpitations, and even tinnitus. Another lesser-known sign of high blood pressure is muscle tremors or hand shaking, while often overlooked or mistaken for anxiety or fatigue. These tremors can actually be a physiological response to rising blood pressure. When blood pressure elevates significantly, it activates the sympathetic nervous system, the body's fight or flight mode. This leads to the release of stress hormones like adrenaline, which can overstimulate your muscles and cause involuntary movements such as trembling hands or muscle twitches. These reactions are your body's way of signaling that it's under internal stress, and it's often a red flag that something deeper like uncontrolled hypertension is at play. A 2016 study published in the Journal of Hypertension found that participants with more pronounced hand tremors had a higher risk of developing high blood pressure over time. This suggests that tremors may not just be a symptom, but potentially an early predictor of hypertension. If you've been experiencing tremors alongside other symptoms mentioned earlier, it's crucial not to dismiss them. Your body could be sounding an alarm. Regular blood pressure checks and timely medical consultation can make all the difference. Building upon the previous symptoms, headaches, dizziness, blurred vision, shortness of breath, chest pain, nosebleeds, fatigue, nausea, heart palpitations, tinnitus, and muscle tremors. Another physical signal of high blood pressure that often goes unnoticed is facial flushing. While it may appear harmless or even normal in social situations, frequent or unexplained facial flushing can actually be a subtle warning sign from your cardiovascular system. Facial flushing occurs when the blood vessels in your face suddenly widen, causing warmth and redness. This can be triggered by alcohol, stress, spicy foods, or sudden changes in body temperature, but when it happens frequently, especially without clear cause, it might reflect fluctuating or elevated blood pressure. Research has shown that individuals who experience facial flushing after drinking alcohol may have a genetic predisposition that slows the breakdown of acetaldehyde, a byproduct of alcohol. This same trait has been linked to a higher risk of developing hypertension. A 2020 study published in the Journal of Clinical Hypertension found that those experiencing new-onset flushing after alcohol intake had a 42% higher risk of developing high blood pressure. While not everyone who flushes has hypertension, recurring episodes, especially when paired with the other symptoms we've covered, should prompt further evaluation. Monitoring these subtle cues can be key in preventing long-term damage. Continuing from the earlier signs, headaches, dizziness, blurred vision, shortness of breath, chest pain, nosebleeds, fatigue, nausea, heart palpitations, tinnitus, muscle tremors, and facial flushing. Another critical yet often alarming symptom tied to high blood pressure is numbness or weakness in the limbs. This symptom may arise during a hypertensive crisis, when blood pressure spikes suddenly and severely, leading to acute stress on the brain's blood vessels. In such cases, the force of the blood flow can damage the vessels or cause a stroke, where parts of the brain lose oxygen and nutrients. The result: sudden numbness or weakness, particularly on one side of the body, in the arm, leg, or face. This is a neurological red flag that requires immediate medical attention. Additionally, high blood pressure can lead to a condition called intracranial hypertension, which increases pressure within the skull and compresses nerve pathways. This can affect motor function and sensory perception, leading to weakness or a tingling sensation in the limbs. While such symptoms may resemble fatigue or general tiredness, their asymmetry and sudden onset help distinguish them as serious. If you've already noticed earlier symptoms and now experience limb numbness or weakness, it's a signal to act fast. This could be the body's final warning before a major event like a stroke. Don't wait. Seek medical help immediately. High blood pressure is often called the silent killer for a reason. It can damage your heart, brain, kidneys, and eyes without showing any obvious symptoms until it's too late. But the good news is, you have more control than you think. By staying informed and learning to recognize early warning signs like persistent headaches, dizziness, vision changes, or even subtle cues like fatigue or facial flushing, you can take action before complications occur. Your body is always trying to tell you something. The real question is, are you listening? The key takeaway is simple: regular blood pressure checks, a heart-healthy lifestyle, and acting early can significantly reduce your risk of life-threatening outcomes like stroke or heart attack, whether you're caring for an elderly loved one or protecting your own health. Awareness and prevention are your strongest allies. Have you or someone you know experienced any of these symptoms? Share your story in the comments. Your experience might help others. If you found this video helpful, hit the like button. And don't forget to subscribe and turn on the notification bell so you never miss our weekly health tips designed especially for seniors and care givers. Your support helps us continue bringing life-saving information to more people. Stay healthy and stay informed.